morning, everybody. I see that we have about 17 participants and maybe a couple more that are going to be joining. So let me give people just a second for everybody to connect. I see some names that I know and I see a bunch that I don't know. So hi, everybody. My name is Beth Racine. I'm a professor of public health sciences here at UNC Charlotte. And Mamie Stackey Harris and I are going to be your presenters today. Let me just give you a little bit of background on how this session is going to work. We're going to both present, and at some point during the presentation, we're going to stop and have a discussion session because we want to hear your feedback. And then we'll continue the presentation. And then after we're done presenting, we're going to put you all to work. So we're going to do some breakout sessions. And for one of the purposes of the APHI Nexus Day is to come up with some ideas, because a lot of you are probably working directly on these issues or have similar, have worked in other areas that are similar to this that can really help provide us with some answers to some of this pressing problem of food insecurity. So I want you to put on your thinking hats as you listen to our presentation. During the breakout time, we're going to ask you to think about the people that need to be part of our conversation around food insecurity who are currently not involved, who probably should be. We also need you to think about kind of how our current processes of kind of how our systems work, how our food assistance works, how our grocery store systems work, how our school meals work, how those processes need to be edited or could be edited to address the problem, or how if we need to come up with something brand new, like a new product. So it's going to be organized when we do our breakout sessions as people, so new people that need to be engaged, processes, how we need to change the current processes to make things better, or our products. Do we need something new? Do we need to kind of swipe what we have and come up with some other way to get food, healthy food to people? Okay, so I'd just like you to take notes while we're presenting, because I think it'll just make the breakout session time more efficient. Okay, so at this point, I'm going to turn the presentation over to Mamie, and she is going to start the presentation. And before I do that, actually, I need to share my screen so that you can see the PowerPoint. Hold on a minute. All right. Let me make this bigger. Let me get the slideshow to start. Okay, I assume everybody can see that. And if not, please let me know. Mamie, please take it away.
Awesome. Thank you very much, Beth. My name is Mamie Stackey Harris, and I'm the Food Security Supervisor at the Mecklenburg County Public Health Department in the Office of Policy and Prevention. Good morning, everyone, and thank you very much for joining us. We appreciate it. We appreciate your expertise, and we look forward to some interactive discussions. What I'm going to do, Beth and I are going to be sharing the discussion. I'm going to briefly go over our objectives. Next slide, please. And I'll do the first portion of our discussion. Beth will jump in, and then I'll jump back in again. So next slide, please, Beth. So the goals of our this particular presentation is to define food security, to give the general overview of the local food security data for the Charlotte area, hone in on some of the COVID-19 food security impacts, and then also look at some current efforts that the county is doing. There are quite a few efforts, so we'll kind of go through pretty quickly those efforts. And the goal is just to give you a broad sense of what's happening. So as you work on or you think through what those 3 Ps are, the products, the processes, and the people, you kind of get a sense of what's generally happening. This is no way an exhaustive list, but it just gives you a good sense. And then that's where we'll be doing that next step. So that next step is that's really doing that interactive discussion. Next slide, please. All right, so before I jump into food security, what I wanted to do was just kind of touch a little bit on what Dr. Telfer had mentioned, the social determinants of health. our discussions are going to be really based in this. Food security cannot be viewed as an independent entity. It is worked within the social determinants of health. And the definition we see here, it's one which is extremely encompassing by the World Health Organization. And it talks about how these are the conditions, that's the social determinants of health, where people live, are born and grow. And not just that, but it's shaped by the distribution of power, wealth, and resources which are around that at the local, global, and national level. So what you see on the right-hand side is a socio-ecological model that's at the right bottom, figure 1. And we use these socio-ecological models when we talk about the social determinants of health to see how that overlays from the individual level all the way down to community. And in this sense, that community level is also including things like the policy environment, where those policies are made, which actually hone down onto the individual and in that interpersonal and community level. So it's really important that as we think of food security, we think about it across that sector. And the social determinants of health icon, which is right on the top, that's the Healthy People 2030, tries to do some aspect of that, where it shows the person in the center and it shows the different conditions around which impacts that individual, the economic, social structures, education, and all these things are extremely interconnected. And it's within this complex array of systems that we see food security undercutting all of that and cross-cutting it. Food security thereby is extremely complex, and I want you to think about that as we're working through this. Next slide, please. So what is food security? A simplistic definition is what I have over here, which talks about a household's ability to access nutritious foods and to contribute to an active, healthy life. This in no way justifies what food security actually is. And there's a more encompassing definition, which I would like to use for our purposes. Next slide, please. Within food security, as I mentioned, the social determinants of health, we have things like racial disparities working. So as I work through this definition of food security, what I want you to be thinking about is things like equity, things like disparity, things like equality. Also thinking of racial equity in the context of food security. And when we say that, we're talking about a condition where racial equity with food security is a condition that would be achieved if one's racial identity no longer predicted the opportunities and barriers that the person experiences. And in terms of hunger, that would be achieved if one's racial identity no longer predicted that person's risk of experiencing hunger. So within that context, we'll talk about food security. It exists when all people at all times have physical and economic access to sufficient, safe, and nutritious food that meets their dietary needs and food preferences. This is the World Food Summit definition of that. And as you can see, this is extremely highfalutin definition. It says all people at all times have access that is sufficient and safe to nutritious foods. And this is broken down into 4 key elements: the physical availability of food, the economic access, therefore the resources to get that food, the ability to utilize that food once you get it, and then the stability of all these 3 things. In other words, we have to have these three things consistently present for an individual at any point in time to be food secure. And that is the goal that we are aspiring to get when we talk about food security and what the globally we are looking at when we talk about zero hunger and the sustainable development goals. So next slide, please. This slide breaks down those 4 parameters of food security I mentioned: the availability, access, utilization, and stability. And I'll briefly mention that and explain what those mean. So the availability is that supply side, how we bring food from the source to our communities. And we saw that with COVID-19, how that totally exacerbated that system. We saw food rotting on farms. We saw people having to grind down food on their in their farms. We saw locations where people did not have access to food. In other words, they couldn't even move the food around. And that's where that physical availability comes in. How do we move food from one source to the other? And then we have the access. This is the resources. How can an individual, once we bring food to your community, are you able to access that food? And it's in this context where we talk about things like food deserts, we talk about economic stability, we talk about market prices, because an individual may not be able to access that food once it actually comes to their neighborhood, if they even have access to that food, and ability to even get to that food within their neighborhood. I won't go into the definition of food deserts. I'm quite sure many of you in this particular workshop are familiar with that. And then utilization is, once we get that food, how are we able to utilize that within our bodies? And therein lies those disparities again. What is that health status of the individual once they get that food? How equitable is that, so that once they get the food, they are able to utilize it in the way that it should? And can they even choose foods that are preferable to their cultures? And finally, the stability, as I mentioned, is having all those three things consistently available for us to talk about food security. And as you're thinking of the ideas and processes, the 3Ps, I want you to really be thinking about these four structures, because that underpins what food security really is. Next slide, please. So over here, we talk a little bit of some of the data. So we have on the left side the definitions on food security through insecurity as by US Department of Agriculture. The food secure situation is where there's no problems accessing food. And then the very low food security all the way at the bottom is where one or more household members have reduced eating habits and patterns and are totally disrupted due to resources and ability to directly access food. So we have that scale. And then within that, we look across the nation for North Carolina and Mecklenburg County, just to give you a sense of where are we. Nationally, these are statistics from 2019, actually, the end of 2019, pooled around 2018. And it was 88.9% households were nationally found to be food insecure. And when we look at Mecklenburg, we see that that is actually lower than that national average at that time. Let's just remember pre-COVID. When we look at the percent of households experiencing food insecurity, we see nationally the statistics is about 11.1%, and for Mecklenburg County, as at the beginning of 2019, that was about 14.9%. We know these numbers have completely changed with COVID-19, with over 40% of the nation slipping into food insecurity. Next slide, please. So we compare ourselves to other counties. Where is Mecklenburg County? And we highlighted in red. For the counties in North Carolina, we see we kind of fall around that median, right? About 15%. Again, these are pre-COVID numbers. But Mecklenburg County is the most populous county. So 15% in Mecklenburg County in sheer numbers is completely different from what you might see in Gaston County or in other counties with the most populous. So we do have a grave condition right here in Mecklenburg County, food insecurity and hidden hunger. And it's within this context that we see COVID-19 also rearing its head. I'm going to stop at this point and hand over to Beth. I believe the next slide is Beth, and she's going to talk a little bit about how that whole context comes to bear.
Or food insecure. Well, what we're learning from doing the research is that it becomes this whole cycle, right? People might feel like they don't have the food that they want. They might have the food, and this is actually an area of concern, right? People might have calories, but that doesn't mean that they necessarily have good nutrition. So if we start at the top of this circle, people might feel insecure, and then that might make them stressed. And if they feel stressed, then they might eat, right? Because eating is a very kind of socially acceptable coping strategy. We would prefer people overeat than lean on alcohol or drugs, right? So a lot of people will lean on food. And then it's that leaning on food and developing habits, and what I would say becomes food addiction habits that lead to chronic disease. And chronic disease means that a lot of times, especially if you're under the age of 65, means that you have high health expenditures and you miss work. And that missing work can lead to lower income. So you can just see how being food insecure contributes to this round and round bout of stress and how it can become an unending cycle. So I'm going to go over some stats, some federal stats. So this one shows how much Americans spend on food, which I think is so interesting because actually compared to the rest of the world, the United States spends very little of our income on food. And it's because we're a very rich country. So we spend more of our money on things like our mortgage and our cell phone bill and those sorts of things. So we have a lot of other expenses, and our food, because we generate so much food in the United States, is relatively inexpensive. But that doesn't mean that we don't feel the pinch of the cost of food. So this shows us for the different income categories where they take the US population and divide it up into 5 quintiles. The highest income folks over here in where it says highest, they spend about $14,000 a year, their household spends on food, but that is only about 8% of their income, okay? And then if you go from the highest quintile down to the lowest quintile, you can see that the cost of food, the amount of money they spend on food goes down drastically. So a wealthy family, or the 80th percentile of families or more, which I would call way upper middle class and wealthy, are spending $14,000 a year, and the lowest income families are spending only about not even $5,000 a year. But for those lowest income families, that's a huge percent of their income, right? 35% of their income is going to food. So we see huge disparities in food spending and the burden of food costs, depending on the socioeconomic status of people. Okay, and if you've been around Mecklenburg County very long, I'm sure you've seen a wide variety of these types of slides before. This shows you some of the areas of concern that we've had in the past. So one thing to look at is median income. Where do the wealthier people live? Where do the lower income people live? As Mamie was saying on the couple slides ago, that we have 15% of our population is food insecure. I think a lot of times at the state level, people don't notice or recognize that Mecklenburg County has a high proportion of low-income people, because if you look only at our median income looks really high. I think somebody can correct me if I'm wrong, but I want to say that our median income is close to $60,000 a year, which if you compare that to other counties in the state, it seems like we're super rich, which we are. I mean, as a county, we are super rich. But as you can see, it's only in pockets that we're super rich. And when you look at medians for the whole county, that means that the big part of the population that we have that is low income gets kind of ignored by the state, at least, because they'll say, oh, Mecklenburg's a rich county. They don't need much supports. They've got it all together. But that's because we have a very unequal society within Mecklenburg County. So that's map number 1. Map number 2, this shows the food desert issue that we've talked about last 10 or 15 or 10 or so years that I've been around Mecklenburg County. We've been spending a lot of time talking about food deserts, and that's kind of what this graph represents. It shows the highest percentage of households within a half a mile of a grocery store. So as you can see that a lot of times the families or households that are close to a grocery store are also the ones that are in the higher median income census block groups. And then the next slide is looking at the percent of households receiving nutrition assistance. So this is not a big surprise, right? That the ones that are the areas where a lot of people are provided nutrition assistance. So this is like food stamps or what I call SNAP, the Supplemental Nutrition Assistance Program. Some people call EBT, some people call Food and Nutrition Service benefits. That's where they live. And it's what we've seen before, where we call parts of Mecklenburg County the wedge of wealth, and that's where the wealthy people tend to live, and then the crescent of need, which is where a lot of the lower income people live. Okay, so the next series of slides are slides that I was able to find from a food advocacy group that's very prominent in the Washington, D.C. area, called, the acronym is FRAC, Food Research and Action Center. And one thing that's been kind of interesting about the COVID pandemic is the US Census Bureau started doing these, I think they're called real-time data collection points, where they started asking Americans, big wide ranges of Americans, kind of how they're doing throughout the pandemic. And they've been able to put together some slides around what Americans are experiencing when it comes to food insecurity. So this gives us a little bit better shot of what's going on right now during COVID. And this data is actually dated, as you can see that this was collected in July of 2020. So it's a good while back now. But these were the numbers in 2020 compared to the numbers in 2018. And this is not specifically for Mecklenburg County. This is for the US overall. But as you can see that the amount of food insecurity by each of these various racial groups have, in some cases, tripled, right? Let's look at the Latinx community. It was 5% in 2018, and now it's 19%. So almost quadrupled. And then if you look at households with children, you can see that we're seeing the same trend. And among the white population, it's gone up ×5. And among, again, the Latinx community, it's about the same, it's quadrupled. So shockingly high numbers of food insecurity since COVID has been an issue for us. And this shows the same sort of data, but it looks at it by income level. So people who live in households making $100,000 or more, about only 1% of those households are food insecure. But as you can see, as the income level goes down, the percent of the population that is reporting food insecurity goes up and up and up to 28%. And actually this phenomenon of the people making $100,000 or more having very low food insecurity, I think is part of the problem and for society to understand food insecurity, because a lot of the people that work on these issues, a lot of the people kind of who make the decisions about these issues tend to be in this group, right? The people that make $100,000 or more. So it's this population that doesn't understand what the heck is going on with these lower income populations. So that's just my own personal opinion, that I think that it's very difficult for people that are in the 100% or $100,000 or more households to kind of understand. And here's some more stats on the percent of economically vulnerable during COVID. So this is this particular slide is not about food insecurity. The next one is. So panel A just shows us who's economically vulnerable during COVID. And you can see that there's some disparities in race ethnicity here. And it's huge amounts. Look at this, over 50% for all families with children, regardless of race ethnicity. But the group with the most vulnerability is Hispanics, followed by Black, other Asian, and white. And then in panel B here, we look at the percent of economically vulnerable without enough to eat. And the group that's coming out the strongest here is the Black population, with almost 30%. So almost a third of the Black population. Okay, so at this point, Mamie and I have been throwing a lot of stats at you. And we would like to spend a few minutes kind of hearing from you all in the audience. And Hannah, who is our student helper for this session, is going to put a few discussion questions in the chat box, but we want this time for the next 10 or so minutes, so I'll have to check our time, to kind of get feedback on what you're seeing and what your experiences are with the communities that you work with. So Hannah, you want to post those questions in the chat box, and we don't have to follow these questions. This is kind of an open discussion time. So anybody in the audience is welcome to kind of provide any feedback on what we've talked about so far. And I will quiet myself. So let me, since I'm hearing a lot of, so Connie said that there's no surprises another vulnerable group is seniors. Okay, yep, that's a very good point. And I'm wondering if there's other resources, or if there's resources out there for seniors that maybe are being underutilized currently, or then that might be something that we can think about in the breakout sessions. How about this question of for the rates of food security, if they don't surprise you, what do you think are the challenges other than the funds, really, right? Because of course you need money, but what are the challenges to reach food insecurity, or to challenges to food insecurity other than just money? Does anybody want to open that discussion? Transportation, yeah. Okay, Carol, Carlo, the awareness of the FNS program, I think that is so important. So I don't know if you can speak to that, like how right now do people find out about FNS, and is there a good outreach campaigns go on?
Hey Beth, this is Carlo. Yeah, and I was kind of saving that discussion for our breakout session.
Okay,
I really wanted to kind of talk through maybe some recommendations and some thoughts and ideas that I have about that.
great. I know that there's some funding sources for that, building that awareness, but I know that's other funding. It's like there's some funding sources that say, yes, you can use the money to do outreach, and others that don't.
Right.
Yeah. Okay. Bus lines, access to bus lines, living near grocery stores. Yes. Okay. Thank you for that feedback. Then there was another question that in my own research, when I look at food spending, because I do a little bit of work in kind of food economics, like if somebody has a certain amount of money, how much are they spending it on food, and where are they going to purchase their food? So I'm just curious, and again, you guys can think about it more in your breakout sessions, but when I showed you the amount of money that people spend on food, regardless of their income, at least half of that money goes to food away from home. So takeout, restaurants, eating at the workplace, stuff like that. And I'm wondering if people have any thoughts about that, because that's changed a lot in the last 30 years. It used to be that almost everybody ate at home, and it would be only maybe 10% of their food budget would go to food away from home. But now that is 51%.
And I see here Lee has a comment on social justice aspects and the term food apartheid. You're right, Lee, that's a term that individuals are believing we should perhaps use for food deserts, because the word food deserts gives that connotation that there is some deprivation of food for whatever general social and structural and environmental habits is not naturally, it's naturally occurs, right? That's what we think of at a desert, like a natural occurrence. But we know these are strategic and carefully done. There's zoning issues that come in. And so yes, apartheid is a term which really takes into consideration the structural and systemic ways that create lack of access to healthy food. And I am strongly a proponent of the food apartheid definition as well, and believe that it's probably what we should be doing, knowing that a lot of the large scale stores don't particularly want to go into certain locations because of the cost benefits. So you're hitting the nail right there on the head. It's extremely complex, and the food apartheid term is one that should be continually grappled with. So I like that. And going back to food deserts, I mean, one of the three key things for food deserts are the demographics, economics, and transportation. And Beth is really honing in on the economics as well. Poverty, that's something that Dr. Teffold mentioned. That's really one of those underpinning aspects that continuously keep the cycle going, right? So we need to be looking at economic empowerment opportunities as well as we are looking at food systems and food sovereignty, just really looking at it from a holistic lens. So I like those comments.
Okay, well, maybe this might be a good time for Mamie to show us what's been going on, what her office has been working on and some of the county efforts to address food security issues.
Yeah. And just before we do that, Natalie, I did note the disability you mentioned there as well. And we'll note that for perhaps our breakout sessions. So thank you. All right, so at this point, what I'm going to do is to just really go through some of the programs that that we are working on in the county on, not just ourselves, but with some of our partners at DSS and some of the other health departments across the Mecklenburg County. I'll start off with one of the larger programs that we've just started. Actually, we just got funding for that from the BOCC, and that's the SNAP expansion program. I'm giving individuals who are on SNAP or Medicaid, $40 to be spent at Food Lion. And that's really a way to see how we can bolster that pandemic EBT monies that individuals got, and also the increased limit that has been given to SNAP clients, knowing that it's still not enough. How do we boost that to ensure that monies can be spent on other things and not just food? So, that's the SNAP expansion program, and thanks to the BOCC, we've been able to we started to work on that. Next slide, please. This is the farmers market, SNAP double up bags. Some of you here will be quite familiar with that. We have about 22 farmers markets, or maybe 23 in the county, of which about 20 are participating to some extent in some of these programs. We don't have SNAP double up bags in all of them, but we at least have a SNAP EBT machine in most of the markets at this point. About 50% of the markets all have some aspects of SNAP or double up bags. This is a great progression from just 3 years ago, when there was the there was a study done on the food security situation in Charlotte, and it showed that only 3 markets had SNAP EBT. In other words, individuals on SNAP couldn't access these markets and spend their SNAP dollars there. When they do this now, SNAP monies is doubled, and what we're doing with the funding we've gotten as well is to take the limit of the $20 cap that we had at some of these markets. So an individual can be doubled, matched with whatever amount they spend at the farmers market. And this is a way to not only boost the economic empowerment for the farmers, many of whom are struggling with food security themselves, but also to ensure the food access is addressed in our community. Next slide, please. This is just the map of the food farmers markets programs, which we ensure we deliver the different food drives that we work with on loaves and fishes to make sure the information is being circulated. It's also been translated into Spanish to ensure that we can address that equity sense so that everybody can have access to this and can read and understand where these markets are. Next slide, please. This slide just shows you where those markets are, the map of Mecklenburg. I told you the numbers of markets we have. The markets that have both the carrot sign and the SNAP should tell you that they're doing both SNAP double up bags and SNAP EBT. And the markets that don't have anything are markets that we're still working on to try and get them into this general SNAP double up bags and SNAP ability. Next slide, please. We also working with our Healthy Corner stores, the food security team in Mecklenburg County, and an amazing team of, I'm part of the teams, I guess I'm biased, of 4 other people: Karina Gonzalez, Emma Leone, Reggie Singleton, Abby Wyatt. They work really hard to help roll out these programs. The Farmers Market program is led by Abby Wyatt. The Healthy Corner store program is led by Karina Gonzalez and Emma, both of whom have been with the county more than 25 years if you combine those years. And what they do is to work with these small convenience stores who have committed to working in what we call these food deserts. So these small store owners are in what we call food deserts, where we don't have large-scale retail stores. They have committed to having healthy foods in their location. They are giving a Healthy Corner store certification program, which is done with Raleigh. And they ensure that they can continuously stock healthy foods for individuals in their community. Next slide, please. We have about 22 stores who are doing this and have been doing this for at least 4 years. The refrigeration pallet is something we're exploring to roll out to support some of these corner stores. And what we want to do is just a pilot. So just working with a couple of these stores to bring in refrigeration that the county will pay for, to see if having things like refrigeration will help the store owners be able to increase their stocks, and then figure out if you can work on with some coupon programs as well to bring in that cost benefit program, because just having a fridge is not going to help the store owners. They need to be able to move their products, and they need foot traffic. And many times we know the food that sells is not necessarily the healthy food. So identifying other ways to boost the sale of healthy foods are things that we are exploring. Next slide, please. And many thanks to Karina and Emma and Abby for the programs I just mentioned. Parks and recreation, we worked with our park and recs as well in the expansion of access to food. So in quite a few of our parks and recs, there are some community gardens, and they also have plots that they work on with the community. So we have 18 sites, about 400 plots dotted across the county, so individuals can have access to fresh, healthy produce in their communities. And many thanks to Park and Recs for spearheading these efforts. Next slide, please. This is the Edible Landscapes program that is led by Reggie Singleton. And with this, in addition to what I talked about in the Parks and Rec, the goal is to work in some of our public health priority areas to identify locations where we can have an urban orchard. So individuals in the community can work together to own this, urban orchard, and be able to grow foods which are nutritious and good for that local environment. We pair a lot with the churches in some of these communities, and so far, most of these 7 orchards are at churches, and they work with the communities around them, and it's open to those communities to come and harvest the fruit when those fruits are available. Next slide, please. And I'm just giving a high-level discussion on these, just so you know what's going on in the community. And this is a collaboration with Outteach. Outteach works with Title I schools, and in these Title I schools, what they do is experiential learning, where they have food and nutrition programs at these schools. They have pilot studies on food and nutrition. They do education on food and nutrition, so the students have more exposure to what healthy foods are, how to plant these healthy foods, what goes into the food plate to make it healthy, so we can start those discussions early. We understand that K1 to 12 is an extremely critical group. So in as much as we want to work across the life spectra, we want to make sure that we are taking in that K1 to 12 as well. And many thanks to Outteach for this program. Next slide, please. We're working with Rivendell Farms of the Carolinas to have a food systems map. We don't have anything like this in North Carolina. It's going to be the first of its sort. And what they're going to be doing is really trying to track where we have our different food systems, putting it all together in a map location, so anyone can go online and determine where is a farm, where is a good source for food. And during the COVID times, they were really also looking at where can we go to get those food distributions, what's happening where, what is being distributed, what's nutritious about it. And it's an extremely innovative program. And with the funding from BOCC, we're supporting the expansion of this and the scale up of this program. Next slide, please. Social services, the senior nutrition program was mentioned. I saw in one of the comments, the seniors. This is a group of individuals who are overlooked, very much so in the county. Kajal Patel leads the Senior Citizens Nutrition Program and has done a lot of work trying to see how this program can be rolled out. Most people may be familiar with the Meals on Wheels. That's probably what is typically known as the Service for Adults Transportation. Right now, the congregate sites for adults have been closed because of COVID, but they have 6 grab-and-go locations where individuals can sign up, make sure they register, and go and pick up prepared foods. One thing I'd like you to be thinking about for this population is that a lot of this population are unable to carry food. So even if you have that transportation for them and they bring that cooked food home, it's difficult for them to lug back and forth. And then the time to spend preparing the food, standing on their feet, cooking these foods. So within this community, one thing that has come out is the desire to have fresh cooked foods. So even though, yes, we want them to have access to the fresh produce, something that keeps coming up is a desire for actual fresh cooked food, which is ready to eat. We also know that the public health priority zones that we have in the county doesn't quite overlay with where we have our senior citizens. And we find that many of them are living outside of our public health priority zones. In other words, we are seeing food deserts outside of food deserts, and those are not being captured in the census tracts at all because we have such small populations of seniors living in those locations. Next slide, please. The WIC program, which most of you are probably familiar with, and I have this here just to highlight that we continue to work with our populations to ensure that for breastfeeding, postpartum women and infants, we have this nutritional access to foods and the support systems to ensure that all our population at that critical and vulnerable stage have access to good sources of information for nutrition and for food security. Next slide, please. This talks about as CRC, another innovative program where the goal was to try and bring under one umbrella all the key health and environmental processes. So an individual can just have a one-stop location instead of traveling to one side for the WIC, going to another location to DSS, going somewhere else to loaves and fishes. We have it all within one location, an extremely innovative plan which has been created now at Valerie Woodard, and the goal is to roll out even more community resource centers. Next slide, please. And then we have a One Shot Alliance with a collaboration between Atrium, Novant, and Mecklenburg County. The goal of this is to address the top 3 health priorities from our community health assessment, which includes mental health. Some part of their vision was by 2020 to have identified food insecure locations and have offered some referrals to loaves and fishes, and that's something that they have been able to achieve. They've had, I brought in some mobile trucks which go to food insecure locations so individuals can actually, the food is being brought to individuals. So you can't go to, you're in a food desert, well, we'll bring the food to you. And this is an innovative program with the One Shot Alliance spearheading this. And we're grateful that they are bringing these new ideas into our community. There are 2 mobile trucks for now, and I believe the goal is to expand this to even more. Next slide, please. And these are interventions which are being rolled out to an extent, but there's still a lot of brainstorming being done about it. Next slide. Snap Online. Most of you have heard that this is being rolled out across different states. North Carolina was able to have some Snap Online piloting occurring. The first 2 stores to do this were Amazon and Walmart in North Carolina, actually across the states and the United States of America. But now we're seeing lots more stores rolling on. We'd like to see even more stores. Just yesterday, Publix joined the Snap Online purchasing. This creates opportunities for individuals on Snap to not have to go to a store, but be able to purchase their produce online. There's still a lot that needs to be tweaked with this, but these are some of those policy level decisions which help impact food security. And so we have 7 stores now that are actively doing Snap Online. And the goal would be to see how can we leverage what is already happening in some of these stores. Next slide, please. Mobile grocery stores. We saw an excerpt of that with the One Shot Alliance. The goal here is to determine, can we do something like this on a larger scale, where we are bringing a wider array of food that can be run for a non-profit or for profit, but that serves a wide spectrum of individuals. So you come on there and you actually pay for the food. So it's like a mini grocery store coming to your location. So these are some of the ideas. This hasn't yet been rolled out, but it's happening across different states. And it's something that we can probably very well achieve here. We just need to figure out what sort of systems or strategies need to be in place, who will be coming alongside to actually run this, and how we would make it sustainable if something like this was done in the county. Next slide, please. Virtual markets. This also looks at online grocery without the actual physical store. So beyond just the SNAP EBT, but really rolling out this whole idea on virtual markets where we totally eliminate, or not totally, but kind of eliminate that actual brick and mortar and find innovative ways of doing more online. We can see that happening now. COVID opened our eyes to the ability to do this. How can we capitalize on that? We already see meal boxes and groceries and full groceries being brought to individual houses. We see food that is partially prepped being brought. So, you know, this slide is just to get us thinking of that virtual world as well. How do we tap into what is happening in really creative ways to strengthen what we are already doing in the county? Next slide, please. And this, I'll end on this slide on grocery co-ops. For those who listened yesterday to the discussion of food security, you heard the talk about Three Sisters, a Three Sisters co-op on the west side. That's an example of a co-op that would be a good thing to roll out in other locations. the goal would be, how can we do this sustainably? How can members and have owner fees, really work into an extent that these grocery co-ops actually are sustainable and are things that can stand on their own. But these are some of the ideas on really expanding food security, looking beyond just a brick and mortar, or if it's a brick and mortar, other ways to do this in a way that the community is engaged and it fulfills the need of those unique communities. Next slide, please. This last slide is just really pulling together all the discussions Beth and I have had. In this slide, we have different levels of the kind of what we call the social conceptual model on food security. So we have the baseline, the fundamental level, where we see what's happening at the basic food security level in homes. Before COVID, we knew there were economic disparities at the structural context, there were health disparities, and we had a fragile food system. What happened with COVID? It totally exacerbated the healthcare system. And this is not uncommon to pandemics. Pandemics and viruses, they kill in 3 ways. So that's a general pandemic. The virus itself will kill. It breaks down economic structures, and it also breaks down health infrastructure. And once you have all those 3 things coming into play, we can totally decimate any context. And that's exactly what we saw rolling out in North Carolina and across the United States and globally. There was an economic crisis. We saw the social distancing bringing about livelihood loss. We saw increased demands for food aid. We saw the healthcare system extremely stressed. In some countries, that was completely crippled. And then we also see at the household level that, individuals, because of all these factors, households under stress, behavioral changes, mental health issues, general food insecurity, and then chronic health outcomes because of this overlay. And this is compounding what was already in a pretty fragile system in many of our food insecure locations, which have been further exacerbated by COVID. So, and this hasn't changed. Yes, we are rolling out vaccinations, but yes, we still have contexts and communities where the impacts of COVID-19 are still very present and we believe going to be long lasting. How, as we talk about food security, can we address some of these in those very critical neighborhoods where we already know food insecurity is an extremely pertinent issue? Not just food insecurity. Remember, I talked about the social determinants of health. We're looking at housing aspects as well. We're looking at transportation. We're looking at air pollution in many of these lower income locations where we have a lot of hog farming occurring right here in North Carolina. So compounding all these factors, how do we really start to tease apart working on just one aspect, the food security, knowing that it's cross-cutting and hinges on the general health that an individual can have and the ability to access good healthcare systems. So I'm going to stop there. And we'll open up for actual discussions. Any questions?
Thank you, Mamie. Well, I guess what we might want to do now is go into breakout rooms so that we can kind of talk more one-on-one about these issues. And it's hard for me while I'm sharing my screen to see the chats. So let me pull those up.
So we've posted a question in there. We talked about sustainable food security solutions or initiatives should include a racial justice and equity lens. It must incorporate some economic empowerment opportunities and be grounded in robust food system strategies. That's generally what we would hope when we're talking about sustainable food security solutions. So given what you've heard, given this discussion, as we go into our breakout, or as we had the discussion here, what 2 gaps, and I'm just going to leave it at 2. 1 or 2 gaps do you believe exist in addressing food security here in Charlotte? And how can that be strengthened? Okay. And that question has been posed in the chat.
Okay, I see that. Is this everybody? Are we all back? Looks like we're all back.
Yes.
All right. So I guess at this point, maybe we should have a scribe, and maybe Hannah, if you could be our scribe.
Yes.
And maybe have one person from each of our subgroups kind of share their ideas. I know that I took notes in my subgroup, but I don't have to be the one that does it. So does anybody's subgroup want to report first?
I kind of took notes as well, but if anybody in the group would like, ours was a very small group. We only had 4 people, well, yeah, 4 or 5 people in our group. So I'm not sure what your group size was.
Yeah, ours was about that too. Mhm.
Okay, well. Well, if it, okay, I can speak for, is anyone, would anyone in our group like to share on some of the ideas that came up? All right, I can share. So from the food security, technology divide was one thing that came up. Denise had mentioned that there is a technology divide. So even though we have the SNAP online and other virtual platforms popping up, we realize that there's a significant technology divide in the county. And her thoughts that what are we doing about it? How do we include that in the discussions we have with regards to food security? She also brought up a pertinent point on the fact that this is not just for senior citizens, but this is also for some of the youth. And she talked about the foster care system, where we also have individuals who have bounced from home to home sometimes and don't have access to some of these tools. And then not just that, but the eating habits of some of these children have not necessarily been honed in a way that is also going to be helpful. And therefore, when they come out into society at the age of 18, it's really hard for them to try to determine those good or healthy ways of eating. So that was, I really like that point on the technology divide and what we should look across the age spectrum. Another thing that was mentioned was the importance of the prepared foods. This was, Jackie mentioned that, the prepared foods like the, that were delivered, pre-prepared food that are delivered to households, and how, of course, we know many of the senior population likes that, but also for the younger generation. But she did mention also prepped foods cooked hot meals in churches and local organizations like that, how that can be extremely helpful in our senior or older population group, and ways we should probably be looking at to roll out things like that. We know there's the grab and go options, but what can we be doing to really capitalize or leverage some of these virtual food platforms in a way that doesn't necessarily require the use of technology and will bring about those fresh cooked foods for individuals. And then another thing that came up was a great question by Connie as well. And she was looking really about, well, 2 things that Connie had mentioned: medically tailored meals. That yes, we talk about food delivery models, but very little conversation is on those medically tailored food for individuals who might have chronic health diseases and need to have special diets. And so what is being done to roll out things like that in a wheels on meals fashion that is carefully tailored for, let's say, an individual on dialysis. And then another thing she had mentioned was, where do we have that aggregate information for food security? Where does that sit? We have the Charlotte-Mecklenburg Food Policy Council, we have the Mecklenburg County, and we have other groups. But who is that focal group or point person where we are gathering all this information? I shared some of my thoughts on where I believe that should sit, but that was a question that came up, and I thought was a good one for us to put put in our list. And then other things that were mentioned were, I think Jackie had mentioned cooking classes, and how that is actually helpful. So how we can roll out innovative cooking classes for individuals who might be able to purchase some foods, but not quite sure how to prep it. So that kind of lines up with that Hello Fresh model where the food comes already pre-prepped, right? Or not pre-prepped, but cut up and the recipe with it. But along those lines, ways to innovate access to food. And I believe that was the key things. Did I leave anything out? Or anyone in my group, you can please.
No, you did awesome, Amy. Thank you.
Awesome, great. Okay. Thank you. Yep, that was it. And I'm putting in here in the chat, the Unlocking the Potential for Charlotte's Food System, the Karen Karp and Partners study for food systems, for anyone who might want to read that study as well.
Oh, I should say, Connie did mention, I can't remember if you already said it, but a silo, like a place where you can find all this information for food insecurities, a place where the community can go and, we were talking about who should hold that responsibility to making sure that everyone can be educated and help if they want to.
Thank you, Connie, for the clarification. Yep, that was right on point.
Hannah, do you want to go or see if there's somebody else from your group that would like to report?
Yeah, I can discuss if does anyone else in our group want to give their input on what we discussed.
You go right ahead.
Okay, so we discussed the West Charlotte area, the need for kind of a grocery store or a food co-op to bring food to that area because of how much it is like an insecure area, and figure out a way to strengthen the area and make it profitable for businesses to want to come in and bring things like grocery stores, because right now specifically like private businesses don't want to come in because they think that they aren't going to make money, so they kind of avoid the area. So if there's a way to get like the city and the county to kind of morph together to figure out a way to create trust in the community to bring those businesses in that will help and create long-term solutions. And then we discussed how maybe in schools, maybe the schools might have like community gardens to like help students learn how to like grow food. And then back to what Mamie was saying about like cooking classes to teach them how to prepare the food once they have it, because there are a lot of people that once they have like fresh food, they don't know necessarily what to do with it, how to cook it, things like that. And how some like the newer generations aren't as comfortable with growing their own food or cooking / preparing it. And then we also discussed considering what people may have in their homes. Maybe some don't have like a stove to cook, or they don't have time to cook. Maybe they're working multiple jobs, things like that. And we discussed the concept again of like HelloFresh, but maybe with like the SNAP payment model, and maybe partnering with Loaves and Fishes for meals that come with instructions, maybe oven ready or microwave ready meals, and increasing the number of vendors that accept SNAP payment, other than just like Walmart and places like that. So it's increasing the variety of places that people can go and use those payment systems, and increasing those free delivery and services for groceries and things like that. And we also talked about, let's see, let me look at my notes. I think that was it. I think that's what we discussed mainly.
Thank you, Hannah. So for our group, does anybody want to report out, or would you like me to do it? Or I'm going to go ahead and do it unless somebody says they want to. Okay. All right. All right. So we had a really great discussion. We had two folks from the Community Resource Center, Marla and Adrian, and then we had, I'm going to say your name wrong, but I think it's Hampton, Mr. Bailey, Humpton? Hopton. Okay, I'm so sorry. Hopton from DSS, who joined our conversation. So we had a lot of discussion. I would say put these in the process bucket around increasing a need to really increase awareness to the public about all the various activities that are out there, or all the various resources that are out there, because there's a lot of good stuff going on that a lot of people just aren't aware of. So definitely directing some attention to increasing awareness, and not only to the community, but also within these various government agencies. And the example given was DSS, is that a lot of times even the people that kind of work in government programs might not be aware of the food insecurity issues that we have here in Mecklenburg County. So a system to improve that information exchange. And Carla mentioned that we really need to increase partnerships. More partnerships is really helpful, because a lot of this work can't be done by one group alone. And Mamie showed a lot of important partnerships, and that there's probably a lot of opportunity to develop more of these sorts of things. And the CRC has a wonderful connection tool that lets people know kind of what else they might be eligible for. So maybe making a better use of that, so that more people are aware of that. Okay, so in the area of, also I would say in process, maybe more education to teach folks how to better use their food dollar, or how to better use their food assistance benefits. And I told them all about the SNAP-Ed funds, and how if we were able to get some SNAP-Ed funds here in Mecklenburg County, those funds could be used to address many of these things. And then products, in the area of products, a really good idea that Adrian had was for when to develop maybe something like a QR code that many people in the community could, when they see it, they could scan it, and it would provide a lot of information about what are some new resources available to them, because it would be hard to kind of, let's say on a billboard or on a sign, say, these are all the resources we have in our community. But if there's like a QR code or something that's put in public places, people could scan to kind of see what is available. So those were all of the notes that I had. Oh, one thing that just, I know that we're going to probably start discussion now, but I just want to, because I have this on the tip of my mind, I just want to say it. When you guys were talking about making more hot meals available, especially with the use of SNAP, there is a federal program called SNAP Restaurants, but I think your state has to opt in. And I don't think North Carolina has opted in. So I don't know. It looks like Mamie knows about this program. I had just learned about this program a few days ago. So that might be something to advocate for, is to try to get SNAP restaurants, because when you get SNAP restaurants, there's certain sections of the SNAP population, from what I understand, older adults and the disabled, who can use their SNAP benefits for hot meals as part of that program. So I'll stop there. Does anybody have anything to add to what I've just said? Anybody from our group?
You covered it. Thanks, Beth.
All righty. So we have about 10 minutes left. Is there any general discussion that we want to have at this point?
Yeah, I think that maybe we can, do we want to get as a group, figure out what are our top 3 ideas or top 4 ideas or something? Because these are good ideas, but quite a few still. What would you, or Beth and I can just do that on our own, but it would be interesting to see how you would rank them. I'm not sure if we could have done a Zoom poll with this. Did we have a Zoom poll set up? I thought we had a Zoom poll for some questions, Beth.
We were going to, but we never, I needed to know yeah, we didn't organize it well. So I'm sorry. We were going to do a Zoom poll, but maybe if those in the audience can just kind of let us know of the things that have been mentioned from the 3 breakout groups. If you can mention 1 or 2 that you thought were really critical for us to focus on. If, let's say, we're given $1 million, which of those things would we spend it on?
Well, I would say, and this is Hopkins speaking, I would say definitely those two state programs that you mentioned that that Mecklenburg County specifically or North Carolina is not participating, like in the SNAP restaurants and also the education component, because especially since we're at 14.5%, at food insecurity, more education as well as more availability and the resources out there just for us to participate and increase knowledge and awareness. I believe those two things will help get us in a better place.
Thank you.
Any other thoughts from people on what really stood out to you?
I think there's some listed in the chat.
Yeah, I'm looking, I'm seeing the SNAP restaurants and then the information just, well, after COVID. COVID is going to change the way we do things. Will we ever go back to the true pre-COVID? I'm not sure, but okay.
I think one of ours, Mamie, is probably going to be this increased awareness of services, because we heard it a lot in our group, and I think I heard you report on it in your group as well.
Mm-hmm. Yeah. Increase awareness in a central location of sorts where information like this can be gathered, so individuals who are interested in or want to understand what's happening in the Charlotte regional area food security would know where to start to look. Right now, information is so dispersed. So yeah, I think I would definitely agree with that.
I think this is Connie, and obviously that was one of my highest priorities. I think it helps us all who are working in the space to have better synergy and not be duplicative. I think we could waste a lot of time and energy duplicating something that someone else is already doing because of lack of knowledge. And none of us have time for that.
Mm-hmm.
And to reiterate what was said just now by Mamie, it's just like gathering all the various things that we have that we ensure that we aren't duplicating, and just having them all in one place so that people are aware of everything that's out there, so energies aren't wasted.
Well, we're glad you stayed till the end. Our group dwindled down to about 50%, but it's great that we had some strong cheerleaders who stayed on.
Thank you for spending your Friday with us.
Appreciate it.
I know the weather is gorgeous. So it's easy to play hooky today.
And then, of course, as thoughts come up, our emails, I'll drop my email in here. It would be, I'm happy to, not sure if we had our emails on the initial slide, but we'll put it in here as well.
I'll put mine too.
Yeah, it would be great we would love to stay in touch.
Yeah, and I think, as we talk about all these resources, like the marketing is going to be a major component of it as well too, because we can do it through the county, to Employee News Now, different county leaders speaking about it, different departments speaking about it. We're over in law enforcement speaking about it, and PSS and all these other major entities, giving the same message in the community and stuff, because they are in the community and all. And if we can continue to get the message out more, then more people are going to know. So using the technology that we have to spread it and be able to get it in the hands of someone, even creating an app or whatever that makes it easy for folks to be able to get the information, but also the access.
Great point.
Thank you, Hopton.
Yeah, yes, I see that. Yes, we do have the One Charlotte. I'm assuming you're talking about the One Charlotte Alliance. And yeah, we work closely with them as well. If it's the One Charlotte Alliance you're referring to. Yes, I believe that's a group that we need to leverage a lot more as well, because the One Charlotte Alliance really wants to work in that central location too. So it's definitely a group that we need to do a lot more with. Thank you all very much for your participation. We appreciate it.